They say that a week is a long time in politics. Well, it was only a week ago that we did our first video, and here we are again with even more to update on. The first thing I want to talk to you about is stockpiling. Forget toilet paper, hand sanitizer, asthma medications such as Ventolin are now the new currency in this hoarding, panicked environment. The really sad thing is that if people stopped taking more than their immediate needs, then the supply chain that's in place would cope with demand. Many are only concerned about their own well-being and needs, and the selfishness that we've witnessed over the last few weeks has really had an effect on the team. We've been blatantly lied to, which is not nice. People try to concoct stories and demand medications, telling us that their needs outweigh the rest of the community. Some are stockpiling, coming in from out of town, and many are trying to game the system. Some are genuine, some are not. But you know what? We can tell. We've just been too polite to say it, to call you out on it. Up till now, it's going to stop. Please don't do it to us. In fact, the hoarding's become so bad this week that the federal government has had to step in. Like naughty children being censored by a parent, it's embarrassing that it's come to this. The federal government passed regulations that allow only 1 month's worth of medication to be supplied at one time, as well as a number of medicines that are on the critical list. We have a list. We will advise you that you're only allowed one purchase if you try to buy more than one. Don't fight us on this. Do the right thing. After you receive a month's supply, please don't come back in 3 or 4 days and ask us for another month's supply. What we'll be doing is monitoring your prescriptions, and the only way that you'll get another supply is a minimum of a 20-day wait, which is still 10 days early, so you won't be without your medication. Our suppliers are also drip feeding stock to us to ensure that it's spread equitably across all of Australia. To counter this, we have waiting lists. Please only put your name down on the list if you truly need medication urgently or within the next 10 or 12 days. We're currently taking orders for Ventolin, for Fluvax and for hand sanitizer. I ask you all for your patience and consideration. We don't want to see you miss out on getting your medication, and we really are doing our best to make sure that this does not happen. The second thing I'd like to talk to you about is the changes that you'll see at the pharmacy. Over the last week, the Busselton Hospital Clinic has set up a fever clinic, and it's been operational and started to test people that are in the southwest. Unfortunately, we finally have cases that have been confirmed to come from Busselton. Coronavirus is here, and it's been spread in the community. It's time for all of us to take this seriously, which brings me to the next point. Being part of the community, we've had anecdotal evidence that many are not taking self-isolation seriously. We hear reports of people still going to work and still out and about. They rationalise this because they say, well, I'm young, I don't care if I get the coronavirus, it doesn't matter, I'll survive. Or else they may have felt well enough where I haven't got it, I can still go to work. But as we're finding out, many people can be asymptomatic for a period of time. Or sometimes they might say things like, oh yay, I've missed the cutoff by 1 hour, 1 day. But do you think the virus cares about time? If you've come back from overseas, you've come from high-risk areas to Busselton, Dunsborough area, which was a low-risk area, don't be responsible for someone getting sick. Don't be responsible for someone dying. If you know of anyone flouting the isolation rules or stretching them a little way too far, actually call them out and contact them and tell them, and this is the time for them to do the right thing. People's lives will be saved. The virus is here. Now, what do we do about it? At both Dunsborough Pharmacy and Nourish Pharmacy, we had a meeting a few weeks ago, and we came with a plan. Now, it's not a perfect plan, but hopefully it's a plan that will enable us to keep supplying you with medication. We have split the pharmacies into 2 teams, an A and B, and our rostered staff now no longer cross over from one team to the other. The reason that we've done this is that should someone from one team be diagnosed as having the virus and have to go into self-isolation and care, then the other team will be able to step in and pick up the extra rosters if required. We may even have to change opening hours if this is the case, but we will keep you informed, because at this stage it's in the future. We just want you to know that we do have plans in place, and feel reassured that we are doing the best that we can to stay open. The next time you visit the pharmacy, you'll notice we are now controlling the entry and the exit doors of the pharmacy. You'll be asked to verify that you have no symptoms before you enter the store. And as a welcome gift, you'll be given a dollop of hand sanitizer and told that you can then enter the store. We've also revised our points of contact within the pharmacy, and we will now not be requiring you to sign any prescriptions, and we would prefer that you pay by card, although we do have measures in place if you still require a cash payment. We're also limiting the number of patients or customers in any store at the time. Please bear with us if a group of people head in at the same time. We will probably ask everyone, if they are in a group, whether all need to enter the store or whether one person would be the best person to go in. If you're asked to wait, please be considerate to the staff who is asking you to stay outside. It's not only their job, it's their health that they're worried about. Please do your bit by respecting the social distancing rules and look out for the tape that we have on the ground. Maintain your distances and don't lean on the counter or look over the dispensary benches. The team has come under enormous pressure over the last few weeks, and they've maintained composure under some very trying circumstances. I'm really proud of them being so flexible and putting their community's needs ahead of their own family and personal needs. Our team are unrecognised champions. The time for selfishness is over. The time for entitlement is over. We all need to learn to share. Get what you truly need and leave other vital medications for other people. Our 3 priorities for the pharmacy are to get us through this, unprecedented event, of coronavirus is, number 1, protecting the health of our team. They're frontline health workers. They're in a high-risk situation. The measures that we have put in place are designed to minimise the risk. We also want to protect the health of the vulnerable in our community, and they make up a large number of the people that come into the pharmacy. And one of the ways we're doing that is by doing deliveries, but we're also trying to make sure that they're the ones that are receiving medication that is being short. And finally, we really want to be able to continue to look after and care for the wider community of Dunsborough. And the best way we can do this is by remaining open. And so we're hoping that our Team A and B approach, or B1 and B2 approach, will ensure that your medication is available if and when you need it. Thanks to everyone for listening all the way through. Take care and stay safe.